Hi, so I'm a real doctor. I don't just play one on TV. And I wanted to explain to folks why we need to have a single payer system in the United States. It's not possible to have universal health care coverage when you have for-profit health insurance companies at the center of your healthcare industry, because you are immediately at diametrically opposed odds with the insurance company and the patient. Here's how you can see it more clearly. So you have a patient who says, I'm sick, I need medical care. And over here, you have an insurance person who says, but I'm in the business of making money off of you being sick. Well, that person who's sick pays a premium to their insurance company in the hopes that that insurance company will pay for their care, right? That's not how it works. So here's the lady, and she says, I have $1. How much health care is that going to buy me? And the insurance guy says, well, I really don't want to pay for your care because any money that I pay for your care is money out of my pocket. It cuts into my profits. That's called medical loss. Medical loss. Seriously? And they hate medical loss. What is medical loss? Well, medical loss is what the insurance industry calls payments that they pay to doctors, pharmacies, and hospitals. They want to keep their medical loss at 20% of their bottom line. 20%. So, healthcare consumer says, well, what does that mean, really? Well, what it means is you've got $1 right here, $1, and the health insurance company takes that $1 from you, but in exchange, they only give you this much health care, 20 cents. That's a crappy deal. Well, where does the other 80 cents go then? It goes to the shareholders, it goes to the CEO, and it pays his bonus, and it also goes to administrative costs. And in the private sector, that's about 30%. You heard that right. For every $1 that you spend, 30 cents of it goes to pay for administrative costs. Highly inefficient. And the reason that it's inefficient is because every insurance company creates an individual contract with every hospital, pharmacy, and doctor that they contract with. And all of those rates vary. All of those rates necessitate different forms and different filing systems, incredibly inefficient. The result is that you lose a lot of money and you don't provide much care. Much better if we go to a single payer system. But wait, single payer. Single payer, doesn't that actually mean socialized medicine? Isn't that bad? Well, we already have socialized medicine in this country. We have two forms of it, actually. Medicare, which covers people over the age of 65, right? And the VA system. Okay, so what are their administrative costs? For the VA, a single payer system, i.e. the government, and Medicare, again a single payer system, i.e. the government, their administrative costs are about 5%, because you have one payer, one rate that they pay to the hospitals, doctors, and pharmacies, and no bugaboo about payments and different forms and where do you file it and how did you fill it out. It's simple. Okay, so then you go, so for every $1 that I spend on a premium, if I paid it into the Medicare system, how much care would I get? You get 25 cents, 50 cents, 75 cents, 85 cents, 95 cents. That's a much better deal, don't you think? I think so. So does this lady. I'm going to be putting more videos on Facebook. I would love for you to share them with your friends. We need to educate the public. More to come.